Centering pregnancy is a very exciting way of delivering prenatal care. It is done in a group setting for women who have due dates that are approximately within the same month. And these women are then allowed to attend group sessions in which they receive the same information regarding their pregnancies together, allowing for bonding and people to have different input in regards to questions and their experiences with other pregnancies. And we find that it's a really great experience for women to move through pregnancy with other women who are having similar troubles or similar positive experiences. So once a woman has a confirmed pregnancy and she's interested in being in our centering program, what we do is enroll them approximately around 12 to 16 weeks of gestation, and they have 10 visits throughout their pregnancy in which they visit with another group of women with similar due dates, and they meet with a provider who is a certified nurse midwife and a nurse. And they go through 10 topics which are actually aligned with the Centering Healthcare Institute's Centering Pregnancy Program. Those include nutrition and safety during pregnancy, contraception, breastfeeding, parenting, and relationship, healthy relationship. So there are multiple things that we try to discuss with women throughout the pregnancy, and during those discussions they are then able to bond with other women who are having similar experiences or may have input that would then help the other women in the group.
So I was really super excited to come and be involved in where I can learn a lot more and be interactive with other women that have had children already.
You can kind of relate to some of the stories that we all give each other because some of us have been through the same thing. Some of us could give ideas to like some of the people in the group that have no kids.
You're really seeing patients shine and find their voices and, share their experiences. But I'm also seeing an emotional component, especially with a group interaction, that you don't ever see in a traditional clinic. The bonds that are formed between me and my patients are strong. The bonds between the patient and the patient are strong. The postpartum parties that we have, they all bring their babies in, and they're just so very cool with each other, and they respect each other, and I think that's the biggest difference that we're making. We're reducing preterm birth, we're improving outcomes, which is the best that you hope for as a clinician, is to improve some sort of outcome. But we're doing it in a way that it doesn't feel like we're trying very hard, but it works.
We were bonding because we were able to talk about different issues that you don't really get to talk about, like when you go to a traditional doctor's appointment, and each lady would share their stories, and you can hear different things that can help you along the way, that they went through that maybe can help you that you're also going through.
It was great. It was like, I was hoping a lot more informal. You kind of felt like you could bring up topics that maybe you wouldn't be comfortable with just one-on-one with your doctor. Even though you should be, but you aren't always. And it's a bunch of girls that they're going through the same thing as you, and it kind of becomes just a lot more like you're talking to a friend.
We take care of women of all backgrounds, and we would like to reduce the rates of preterm birth in South Carolina significantly. Currently, our rate of preterm birth is about 12%. It's higher than the national average. And so anything that we can do to intervene and help babies come at a later time when they'll be most healthy, we find would be a positive intervention.
Seeing my patients today, seeing my babies today, it makes you go home and realize that centering is making a difference and centering is improving outcomes. But since that's the ultimate goal, it doesn't actually feel like you're forcing the outcomes. They just happen naturally, and that's I think the magic of centering.